Sciatica podcast recently, and
Oh,
I was like, you know what I loved about what you said, I'll start by this, and then I'm going to let you take over. When you said, you know what, look, sciatica, no two sciaticas are the same, and that there really is an individualized perspective, and you just really came off as a true expert, actually. So I want to let you know you projected excellence and an expertise, and then I went right to your website. I'm like, you know what, let's just get right to it here. So I'm glad, because honestly, in my existing PT, it's just he's like a 2 years out of school, a nice young man, but he really doesn't know sciatica that much, and he's kind of taking this general boxed approach kind of thing. And I'm in like 3 weeks in, it's just not really, you know what I mean? It's just not. I mean, I think the exercises are going to help me, but anyway. So I just figured I'd start by saying that. I
yeah.
don't know if the
Well,
lighting is great, but can you see me well enough?
yeah,
Okay.
I can see you just fine.
Okay,
Yeah.
good. And I have a
Now,
camera that I can move too. So
okay, perfect. So at one point, we're gonna have you move that camera, but right
okay.
now, before we get started, Jay, do you have any thing you want to add to what you sent me already?
There's one thing that I want to add for sure. I did send you about my surgeries, right?
Yes.
Um, I guess here's what I would say, interestingly, and it's just been coming up. So I will, what I find when I wake up first of all, I go to bed in pain, right? Fine. And then I wake up, I can barely get out of bed when I wake up, right? That's just kind of like, so it's almost like when I'm laying in bed, I lie on my back. That's how I sleep. And I'm comfortable and it's okay. But then when I get out of bed, then that's where like my glute muscle is just throbbing. And then sometimes my lower back, sometimes not, fine. But then all the way down my leg, there's just this like pain down the right side of my leg from the knee down. And then my toes are tingling pretty much every morning when I wake up. And then, so then what my first routine is, I go, use the bathroom. And then I'm like, all right, I got to take a walk. I take about a 45-minute walk. After 45 minutes, most of the symptoms have subsided at that point, which is encouraging. But then I do some stretching. I've been doing some stretching that, I was given by my chiropractor way back, even though I'm not really seeing a chiro at this moment, but and seemingly are helping. They're really just kind of, each leg to the knee to chest kind of thing, both sides, and then the two knees to chest, and then just really stretching on my hamstring, and then glute bridges. I do that every morning, and it kind of gets me going a little bit. But here's what the thing I wanted to say is, in my shoe on the side, and it was interesting because my left shoe never an issue, but when I'm walking, what I've been noticing is my foot sort of kind of slides to the right of the shoe.
Hold that up a little higher if you would, Jay.
So this
There
is
you
the
go.
shoe. It's a Hoka shoes that I'm wearing.
Yeah.
But it's almost as though my foot is kind of tending to the right side of the shoe.
Yes.
And since it's my right leg, I said, maybe I should tell Rick that. I don't know if it matters, but
It does.
okay.
Yeah.
And that's definitely the case. Where my left shoe fits just fine.
Yeah.
And then
We'll be measuring
my right leg.
something. We'll be measuring some things that will probably shed light on that. So that's a good observation on your part, Jay.
Okay.
I'm
And
just
then
making
beyond
some notes.
that, just I guess, in terms of just like recreating the pain, if you will. I'm a college professor. That's what I do for a living. So I sit down a fair amount. When I'm writing, I sit down, but now I can't really sit down more than like 20, 30 minutes before really the symptoms really start to throb. Then I just get up and I walk around my floor 2 or 3 times. I call it like my little laps. And then usually I can sit for a little longer, but I also have a stand desk now. So I work standing up primarily too. So, and then of course, when I'm teaching, I've been wearing sneakers because when I wear my shoes, I find that it's worse when I have my shoes on than the Hoka sneakers. There's no question. There's better support from the sneakers. It's seemingly. So I thought I'd mention that. And then, I'd love to avoid surgery if I can.
Yeah. I think you'll probably be able to avoid surgery. Okay. So let's see. You've given me some really good information here that sheds a lot of light on why you're probably having this. Now, you mentioned that before you go to bed, when you go to bed, you have a lot of sciatic pain. Are you then sitting before you go to bed? Is that what's happening?
Usually, yeah. And what I've been doing is, I don't even know if it's helping me, but I bought this red light pad. The red light pad, and I don't know if you want me to show it to you. You probably
No.
so what I do is strap it on like my right glute, and then that area. And honestly, I usually been doing it for like the last couple of weeks or so. I got it for Christmas, I should say. It gives me a lot of comfort as I'm sitting there. It's only so for like an hour, at least I'm sitting with no pain. You know what I mean? I don't even know if it's really helping. And then I usually follow it up with ice. So that's kind of my routine when I get home. I kind of And then the other thing, unfortunately, I'm going through a divorce right now, which sucks. So I think thank you, but that added stress can't be helping me right now. Dealing with this other thing on too. So but I'm down about 30 pounds, I'd say, in the last year. And so I was at like 253, 252 before because I had the surgery in February of 24. So in October of 23, my weight was 253. And now I'm at 219. So I've lost a lot of weight since then. And I'm hoping that it would help me with my recovery, and hoping that in the long run it would be better for my joints. I think it will be. And but that's what's going on.
Okay. Your hip replacement, was it an anterior or a posterior approach?
Now, when you say the anterior approach, now that's when it's minimally invasive, right? Is that correct when you say the anterior?
Correct. Usually they go in through like the TFL area over here on the side instead of the posterior part of your hip.
Yep, right here.
You'll have to tilt your camera down. I can't see you.
Yeah, let me do this here. So if you see right here, oops, can you see now or no?
Yes, yeah. That looks like an anterior approach.
So like right here is where the
perfect. Okay.
And you know what? Look, seemingly it was a success. I mean, certainly the doctor told me it was a success. And you know, when you look, I'll tell you, when you look at it, it looks like I have a bionic hip. Actually, it's like it looks so perfect, and like those titanium hips are out of control. How good they look, at least. I'm thinking Stryker made a lot of money on that particular hip. But what I would say is that really is what ignited my L4, L5. The L4, L5, the way it was explained to me by the surgeon, is that kind of just got a little bit displaced, a little more displaced, and it really just caused the pinched nerve right now that's leading down to the sciatica. That's how it was explained to me, and the MRI certainly looks that way. But I'm getting another MRI done, by the way, like next week on my lower lumbar area. So
okay, well, Jay, no doubt they're going to find things there in the MRI. The question is, how long have those been there? Likely those problems have been there long before this hip surgery.
I think you're right.
So you know,
I think 100%. Actually, I would say 100% on that.
Yeah. So I think your doctor is correct in that the hip replacement triggered a problem. It's not the hip replacement itself; it's the function after it, right? So we have to figure that out, and we probably will.
Okay.
All right.
Good.
Okay. So I have a couple other questions here before we get started. Okay. So I just want to confirm. It sounds like you said that you are sitting down for sounds like an hour before you go to bed. Is that correct?
That's what I've been doing, even an hour, sometimes to 2 hours, between 1 and 1.5 hours, I would say. I sit in the chair. I just bought the chair 6 months ago. It has fantastic lumbar support. That's why I got that chair.
Yes.
And so it's comfortable. It's like the most comfortable thing I sit in. And yes, I do. I've been doing that before I go to bed, and maybe I shouldn't be, but that's definitely what I've been doing.
All right. And so then you're in pain when you get into bed. And you said that you wake up with pain, and you're saying you wake up with pain in the morning, or is this in the middle of the night, or is pain waking you up with what's going on there?
It's hard to know if pain's waking me up because I always have to go to the bathroom when I wake up, but something's waking me up. So I think the pain, it's just my leg is uncomfortable in bed. So sometimes I'll try to put a little pillow under it, you know what I mean? And that gives me a little bit more comfort. But I wouldn't say it's like I wake up like, oh, it's throbbing pain. It's more when I wake up, then I know, oh man, this is gonna stink when I get out of bed. I get out of bed, it's like, oh, it's kind of like this. You know, and then I kind of go like this, and I'll go like this. I'll go like this, and then it feels a little bit better. But even like right there, like my toes are tingling right now, and my right from the knee down to my foot right now on the right side, that's where the pain's shooting. And then my glute right now, like right here is where the pain is emanating.
Jay, your camera's kind of pointing up, so I can't see where you're pointing there.
Okay, here you go. I don't know why I'm doing this. Sorry about
May,
that.
maybe scoot it out to the edge of your countertop, and then I can see more of you too.
Okay, yeah, let's do it this way. Better.
Yeah, and then scoot it down, and then yeah, that's much better. Okay, so
Okay.
where were you?
So like right here, so like right now, when you're looking right now, so when I look here, I would say like right here
Yes.
is where the pain starts, like right here down. And then from the knee down. So if you look at the knee here,
Yes.
it's on this side of my leg, right here on the right side of the leg.
Yes.
My toes are tingling right now.
And is it all 5 toes?
No, it's like the middle toes, I would say. The big toe, not really. That's interesting you asked that question. And then you know what? There's a little pain right now. There's a little pain right here too.
Yes.
Right here is where there's a little pain.
Okay.
And interestingly, I've been working with a trainer. So the PT, and then I've had a trainer. And the reason I started working with a trainer, she's a yoga instructor. And I've read and been told that yoga is a nice place to get to help to try to get you in a long run better place with sciatica. I don't know if that's true or not, but I'm just telling you I did. And so she has me working on hip flexibility, abdomen strength, core strength, and leg strength. That's kind of what she has me working on. And everything seemingly was going pretty well, but then she had me doing sit-ups 2 times. And I found a lot of pain like in my lower back. So then I said, I can't do sit-ups anymore. I'm not sure if that was the cause of it. Might have been though. That's what I was thinking. And since I haven't done sit-ups now for 3 days, that pain seems to have subsided. So it's just like back. Is that a possibility that the sit-ups would do that?
Yes.
Yeah. So if the glute, she's not, listen, she's a great trainer. And she's encouraged me. She's good, but she's she's young. You know what I'm saying? She's kind of going, she's a yoga instructor.
The thing is, Jay, is all of that is non-specific.
Yeah.
So if something helps or something hurts, you won't really understand what is helping or what is hurting. Right. So we need to be more specific. All right. And we'll have some specificity after today.
Okay, good.
All right. So,
I don't know if the camera's working where it is, and I'll move accordingly. I don't know if that.
Yeah. Well, I'm just going through what you sent me, and I have a couple other questions. Okay. So you said that treatment has not helped so far. What types of treatments have you been doing?
Okay. Well, in May of 24, so last May, I had my first epidural shot, and that was up I'm originally from the Boston area. So.
Oh, okay. So Jay, to speed this up, let's just talk about functional treatments. I don't really care about the cortisone and all that
physical therapy kind of thing.
Yeah.
Well, I tried with a chiropractor. This disc decompression therapy, where they put me on a table, and they kind of were trying to separate the disc. That's the way it was described.
Right.
And my chiro up north had recommended that would be a good approach. Honestly, it didn't appear to be helping at all. I think it almost made it a little worse. So I stopped. That was that. I tried that. Then I went to the PT, and PT. What I've been doing is primarily glute bridges. He has me doing glute bridges. He has me doing a big exercise ball where I press down on the exercise ball with 2 hands. I press down on 1 hand for the core. And then he has me doing stretches where I literally take my right leg and put it over like I'm sitting with my leg like this. I guess I could show you. This is a big stretch he has me doing where I'm sitting down and I go like this, and I push down like this.
Right.
And that's a big stretch he has me doing. And then he has me working with the bands where I kind of pull the band out like this.
Right.
And then I have the bands where I go like this. So he has me working a lot of core. And that's it. That's all.
Okay.
That's all I've done. Very general approach.
I wouldn't have imagined any of that would work either. So, all right. So let's go ahead, and I'm going to try and speed this up because I want to get to our examination. Why did you have a right ankle dislocation in February of 1983?
I actually slipped on a floor. I was working at a Dunkin' Donuts, believe it or not, and I slipped on a floor. And when I slipped on the floor, that's what happened to my right. It happened to be my right ankle too, which I thought might be informative.
It is.
The dislocation was It was a big deal. I mean, I had surgery on it. They had to put a screw in there, and my tibia, I think, fractured. I think my tibia was a slight fracture in the tibia, which healed. But so like the dislocation was so severe, it sort of like disrupted my tibia and fractured it. So
Got it.
So I fell on the floor. That's what it was.
Yeah. And how did rehab go for that? Did you feel like you were able to return to full function?
Yes, I think so. Yes, seemingly. Yeah. I mean, pretty much.
Okay. Well, we'll find out today.
What's that?
We'll find out today.
Yeah.
Okay.
Could be. I mean, I don't know.
All right. That could be a very significant issue here. All right. All right. So I am ready.
When I was in high school. Oh, gosh.
I'm sorry?
Back in 1983 when I was in high school. So, oh, well.
Yeah. Yeah. Okay. So just curious, what do you teach and where are you?
I teach financial statement auditing. So I'm the director of the accounting program here at University of Central Florida.
Oh, okay. Great. Yep. Congratulations.
Oh, thanks. Yeah, I just got the job. It's a great job. So thank you.
Oh, really nice.
Yeah, I just got it in June. It's good.
Okay.
But I'll tell you, I'd love to get my body back now.
Yeah. Well, let's get it going. So I'm going to ask you to first take off your shirt and let's take a look at you. I want you to step back and I want you to kind of tilt your camera down a little bit more.
Okay.
Because as you step back, I'll need to see more. There we go. That may be too much because now I can just see your laptop. Okay. Okay. Great.
You want me to tilt it more?
No, this is perfect. This is perfect. Step back even further to that little stool behind you.
Yeah. And again, I can move that further.
No, you're great. You're great. I'm just making some notes here.
It's interesting though. I was thinking about my gait. You know, my right foot sort of tilts that way when I just stand up slightly.
Mm-hmm. There's a reason for that. Okay, so now let's have you turn sideways. Okay, and now let's turn your back to me. And then finally the other side. Perfect. Okay, now Jay, I'm going to ask you to lie down on the floor on your stomach with your head facing away from the camera, your feet towards the camera.
Okay. Do you need to tilt it down farther?
No, you're perfect where you are.
Okay, so like this?
Yeah, perfect.
Almost like a Superman pose?
Yeah. Now bend both of your knees.
Oh, bend them.
Allow both feet to fall to the outsides of your body.
I can tell you that kills me on the right side right now.
Yeah. And Jay, I don't want you to force it out. I just want you to show me where it's not. Yeah, there we go. Okay, now let's straighten your left foot down to the ground. And then let your right foot fall across midline to the back of your left knee. Okay. And does that hurt your right hip as well?
Not as much.
Okay.
A little bit. But like this hurts more. Like right there hurts.
Yeah.
And this doesn't hurt nearly as much. A little bit. But not as much.
All right. And now let's straighten your right foot down to the ground.
Yeah.
And bend your left knee. And let that fall across midline to the back of your right knee. Okay, got it. All right, now, Jay, what I'm going to ask you to do, this is going to be a bit of a strength move since we're on the floor here. And if you don't feel comfortable doing it, you let me know, okay?
Yep.
Let's move that second stool out of the way too, because I'm going to ask you to be perpendicular to the camera.
Okay, yep, no problem. Let me do that.
Okay, I'm going to ask you to lie on one side and we're going to get into a side plank position. So pick a side.
So like this right here?
Yeah, but turn yourself perpendicular sideways to the camera so I can watch you.
Okay, like this.
Yeah, there you go.
I've just started doing side planks actually.
Yeah, we'll find out whether that's a good idea or not real soon.
I'm not sure it is either. So like right here?
Yeah, so we're not going to use your left hand. We're just going to use your right arm to support you. You're going to lift your hips off the ground.
So like like I'm doing right now, right?
Yeah, but now lift your hips off the ground.
Okay, let me start one thing.
No, you can't use that hand. Okay, can you lift the top leg?
No.
Okay, let's try it on the other side now.
You want to try it again?
No,
Okay.
just try it on the other side.
All right, so like this.
Yeah, and you can't use the right hand now. So we're going to lift up your hips.
Okay, and
And can you lift your top leg?
no.
Okay. Did you feel that one side was more successful than the other?
I think the other side was a little bit more successful than this side.
Okay.
Wait, I don't. Let me see. Should I try it again?
Sure.
Okay, so let me just. So you're saying.
So make sure your body's strong, or I'm sorry, long, and so you're not flexed at the hip. So be in a plank. There you go. There you go. Okay. Then just lift up your hips.
This is hard, Rick.
Yeah. You know what? That I've seen enough as far as I'm concerned.
Okay.
So, all right. Now let's go ahead and stand up.
I guess you know what? Now that I think about it, they were both hard.
No, I agree.
So it's not like either one was easy. But now you should know something. I used to lift a lot of weights when I was younger, in my 20s, and I would always focus on this part of my body up. Right? It was all like bench press, curls. It was like the more beach muscles perspective. You know what I mean? And I really didn't focus on my legs. Didn't really focus on stretching. So I'm not really a limber guy at all. I'm working on that though.
I'm gathering that.
I'm working.
All right.
Didn't really work on my abdomen, so it's just kind of like, yeah, it's just like a, I don't know, big lug, I guess. That's kind of what it was, for lack of a better term.
Okay, I'm going to ask you now just to close your eyes for a second and don't move your body at all.
Okay. So like right here?
Yeah, just stand there normally and close your eyes for a second. Do not change anything about how you're standing. Do you feel that you're weight bearing more on one leg than the other right now?
Yes.
Which one?
Definitely more on this left leg. Yes.
Okay, great. I see that too. So if we were going to give it a percent, what percent are you on the left versus the right?
I'm going to say 65%, 60 to 65 probably. Obviously, that's just a ballpark, but it feels like I'm definitely leaning towards the left right now, and I'm not nearly as much weight on the right. Probably I'm compensating. So if the perfect symmetry would be 50-50, I'm saying 60-40, 65-35, right in that range, ballpark. Okay. It just doesn't feel like I'm putting nearly as much weight on this as I am here.
To me, it looks much more significant than 60-40.
Maybe it is. Maybe it's 70-30, you know, because I'm now looking at, like, thinking about it, it's almost like I'm having no weight on my right. Probably more like 70-30, 80-20 kind of thing.
Yeah, that's what it looks like to me.
Honestly, as I'm thinking about it more, I'm not trying to validate what you're saying, but like I think what you're seeing is true.
Okay. So what I'd like you to do now is get a straight back chair, like a kitchen chair or something, and bring it into the room.
Okay. Oh. By the way, this stinks. So
this is what?
This stinks. The whole sciatica thing stinks.
Yeah. Well, you know, I really think that we're going to figure this out, Jay. So this is the beginning of the end of this. Okay.
I'm so encouraged, Rick.
All right. So now, and I don't want you to practice, but do you think that you can stand up using just one leg from this chair height? Do not practice. Just think about it.
Yes.
You sure?
No, but I think I can.
Okay. So I want you to pick a leg. You can scoot to the front of the chair if you want to. I want you to pick a leg. I don't care which leg you use, but I want you to stand up and then sit down using just one leg.
Okay. I'll try that.
Well, I don't care which one you use. So if you're
try my left here.
Okay, and then sit down with one leg.
actually. Couldn't make it.
That's all right. So what I think you should do, Jay, is get a book and put it on that chair to lift up your butt a little bit.
Okay. Okay. Yes.
Maybe a 2-inch book or something.
Yeah.
Probably one of those finance books. You could finally put it to use.
I have an accounting textbook.
There you go.
I'll put a cutting board here.
All right.
All right.
Have a seat on that.
And then try again.
Yeah, try again.
Oh, it's easier. Yeah.
Sit down with one leg. Okay, yep. Now do it with the other leg.
Oh, very well. I got up, but
yeah, just once. I just want one repetition. Oh. Now you're about to do 3. So I've seen enough.
Okay.
All right. Okay. Now, Jay, which leg do you feel is stronger?
I used to think it was my right, but not now. It's definitely my left leg.
And if you were going to give that a percentage strength difference, what would you give? Left is 100%. What would the right be compared to the left?
Well, I literally just did this the other day with my trainer. I stand with one leg up like this, both sides.
But Jay, I'm just talking about this test.
Okay. So this test.
You did it with the left, and then you did it with the right. The left is stronger. We're going to call that 100% perfect. What is your right leg?
60% at best, maybe less, 50.
I would concur.
Maybe even 45, honestly. It felt really.
It's significant.
Significantly weaker, correct?
Yeah. Yeah.
And then this pain right now is becoming evident again, like right here.
Yes. Yeah. I'm challenging you quite a bit in these tests, so that's understandable. Okay. Now, do you have, Jay, do you have a sturdy dining room table or a massage table, or can you lay down on your kitchen countertop? Because we're about to do one other test.
Yeah.
Where we need a hard, flat surface that can support your body weight.
Yes, I'll have to move this though.
Okay. Yeah, that's fine.
Yeah, I could do that. Where can I do this? I can do it up there. Yeah. I have a kitchen countertop. I just got to clear it off.
Okay, perfect. And then Jay, I want to ask you a question. Oh, by the way, you can put your shirt back on if you want, if that kitchen countertop's going to be cold.
Yeah, sure. Okay, let me just go ahead and so it's kind of funny you mentioned the finance book. The first thing I looked at was my automated textbook to see if it was around, but it's not here. So
now I have a question for you. What happens if you weight bear more on your right leg? Does that increase your pain?
Yes. Yes.
Okay.
When I was actually trying to stand on that leg, it actually hurt.
Yes. And where does it hurt, Jay? Does it hurt? Does it create the sciatica, or is it hurting something specific?
It's more like a general feeling that the whole leg is weak right now.
Got it. Okay.
That's how I would say it, but that's
a good answer.
The glute actually. Okay, good. You got it. Okay.
Yeah.
The glute. Okay. The glute's always bothering me, actually.
Yes.
Let's see if I can get up here.
All right. So Jay, before you get up there,
yeah.
I want you to tilt the camera up so that I can see, because right now I can only see the lower part of the cabinet. Okay. So what you're going to do is you're going to sit at the edge of the cabinet to my right.
Okay. Let me just do this. Hold on. Okay. So
you're going to come over here to the camera.
Instead of here.
That's a pretty wide cabinet, isn't it?
It's actually a big island. It's a kitchen.
Yeah, that's perfect. Okay, so just sit right where you are, and now scoot to the edge of the scoot forward towards the camera a little bit. Good. Now lie back on your back with your knees to your chest.
Okay.
All right. Now, Jay, do you ever do this to relieve your sciatic pain?
Yes, but not. This is one of the stretches I do in the morning after my walk. This one right here.
And does it feel good to you to do this?
It does feel pretty good.
Do you ever?
Perfect, but it doesn't. It certainly doesn't hurt it more, and I tend to usually get a little bit of relief.
You do. Okay.
A
Are
little
you
bit.
sure? Are
I
you
won't
sure
know.
about? Are you sure about it getting relief?
No.
Okay. So let's go ahead and lie back there again.
I can't say I'm sure because it's almost like when I'm done with stretch, it's like feels back to normal. So I don't think I'm getting that much relief from getting in.
Got it. Okay, so let's go ahead and lie back. And by the way, before you lie back, if you want to get a pillow for your head, feel free to.
I'm okay. Yeah,
Okay, so we're gonna lie back on that island one more time with your knees to your chest.
Oh,
And you can hear me okay, right?
yes, I can. Yep. So
Okay,
like,
so yeah.
this is a stretch I do every day, and
All
it
right.
definitely gives me some comfort. It feels pretty good right now.
Okay, so I want you to hold both hands on your right knee right now.
Both like this.
Both hands hold your right knee, and your left leg comes down just like you did. But I want you to make sure that left knee is bent 90 degrees and lower it all the way down over the edge of the countertop. Okay, that's good. And now bring that left leg back up. Hug both knees again. Reset your back and pelvis, and then we're going to hold the left knee with both hands and lower the right leg down. Keep the knee bent at 90 degrees. Now, is that painful or is that just tight for you?
It's just tight.
Okay.
It's tight. Yeah.
All right. Down that goes. You can go ahead and sit up.
Okay.
Okay. Let me just I'm making some, we're finding out some good stuff here.
Good. So this is informative to you then.
Yes, very.
Nice.
All right. Now, Jay, what I'm going to ask you to do, this next thing we're going to do, we're going to test your walking.
Okay.
So I'm going to ask you to go ahead and stand on the ground there.
Okay. Do you want me to reposition myself somewhere else or no?
No, you're perfect. So can you see me okay?
Yes.
Okay, so I want you to put your fingertips on your butt muscles right here, not at the bottom, not at the top, but right in the center of your butt cheeks.
Okay.
All right, now I want you to pinch your butt cheeks together.
Like this?
Yeah, pinch them together.
Yep.
And feel that maximum contraction that you're creating. Can you feel that?
So like right here, pinch the butt cheeks together.
Yes.
Yeah, I can feel that. Yep.
Okay, now relax them. Keep your fingertips there. And what I want you to do is pinch them one more time and notice whether one butt cheek is contracting before the other. So pinch that together again. Do they both respond at the same time?
Now I would say the left one, this one here, responds better than this one.
Okay, and now let's consider the degree of response. Are both of them as equally hard and firm?
So that's a tough one. I think so. They're both kind of close. I mean, so
okay.
You're pushing together right now. They're both feeling the same like level of hardness.
Okay.
Is that what you're saying?
Yeah. And now when you relax them,
close, Rick, would be what I'd say. You know what I mean? I can't say it's that different.
I get it. Now keep your hands there.
I got you back?
Yeah. Yeah.
I lost you there for a second. Okay. I probably should go to a different area unless you still need me on this bench.
No, we can go in another area.
That's what I'll do that because I think this is going to be a stronger. I won't lose you. Thanks.
No worries.
Yeah, you'll be better here. Okay. Yep.
All right. So keep your hands on your butt one more time.
Okay.
You're going to pinch them together once more.
So am I doing it right? I think like right here. Pinch. Okay.
Yeah. So pinch them together.
My right one feels a little harder right now.
Okay.
Now that you say that.
All right. So now they're pinched
harder, but I can feel they're both, they're both contracting right now. So yeah.
Okay. Keep your hands on them.
Okay.
Contracting them. And now relax the butt cheeks. Relax before the other.
What's that?
Does one butt cheek relax before the other?
Yeah, the left one seemed to relax a little easier than the right one. Yes.
Okay.
The right one feels really tight, Rick, right now.
All right. Okay.
If that helps. That's what I would say. The right one, there's no question. The tightness in my right glute is significantly greater than the tightness in my left glute. Yes.
Okay. All right. So now you're going to keep your hands on your butt cheeks. And what I want you to do, Jay, is just maybe walk around 10 or 20 steps and notice whether your butt, keep your hands on your butt cheeks, keep your hands. And I want you to notice whether you're getting the, any contraction in your glutes when you're walking.
I'm doing it.
You don't, now, Jay, I want to make sure you're walking naturally. You're not trying to contract your glutes.
Yep.
I want you just to walk naturally. Are you naturally getting any gluteal contraction?
Not really, Rick, honestly.
On either side?
When you say contractions, like you're feeling it like tighten up a little bit kind of
Yeah,
thing?
just like we just tested.
Yeah. Well, no, they're both tightening up as I'm walking. That's correct. And I would say my right one feels tighter than my left one.
Okay.
Yeah, I think that's
now,
fair. I think
okay,
that's a fair comment. I think my right one feels tighter than the left one. Yes.
All right. So now keep your fingertips on your butt.
Yep.
And I want you to go up on your tippy toes now, Jay. And I want you to walk 10 or 20 steps on your tippy toes. Do you feel more contraction on your tippy toes than with your heels down?
Yes. On the right for sure. Yes.
And then if you lower the heels down, does that stay?
My toes. Is that what you'd expect?
I would hope for.
I would say yes. I think the right one is definitely tighter than my left one on my tippy toes. It's much more pronounced, the difference, I would say.
And now, Jay, we're going to do that one more time. And this time, after about 10 steps, I want you to lower your heels back down so they're striking the floor again. And I want to see whether your right butt muscles are still contracting more, even after the heels come back down.
Okay, so start again with my tippy toes, then put
yes, please.
Oh, there's no question the right one's tighter. Yep. Okay. 10 steps. Then up, heels to the floor. Keep walking.
Yes.
Oh, yeah. Yes. I say the right one's tighter than the left. Yes. Yes, indeed.
Okay.
Yes.
Good.
Yep.
Let me just make some notes here. All right, now we're going to put that finance book to work again.
Okay.
So Jay, we're going to need to find a patch of wall, and it looks like you have a patch right there to your right behind you, behind that easy chair. We're going to put the book on the floor against that wall.
Okay. Okay.
Okay. So if you're going to choose, I was looking at the other one. So go ahead and turn the camera so I can see. Maybe put the camera on that chair because I want to see it from the floor.
Do you see it?
That might work. Let's try that. If you can scoot that chair back a little bit out of the way.
I definitely can. Yeah.
All right.
Yeah. I got an exercise ball back here.
Oh, okay. I think that works well.
It's good.
Yeah, that's great, Jay. That's great. Okay, now I want you to face the wall and put your toes up against that book.
Up against it.
And you can put your hand. I'm sorry?
Oh, like this?
Yes. And now you can put your hands on the wall if you want. What I'm going to ask you to do now is put the left balls of your feet on the book, keeping the heel on the ground.
The heel, oh, like this?
Yeah, but put a little bit more of the balls of your feet up there. There we go. That's good. All right. Now, Jay, I want you to lock your left knee back, and it looks like it's already locked back. And I want you to lean your whole body forward from the ankle all the way up to your shoulders. And you'll feel a stretch in your calf muscle on the left. Do you feel that?
Absolutely.
Okay. So just get a bead on how far you can lean forward and how much tightness you feel in that left calf.
Yep. I think the left calf is really tight right now.
Okay. Let's back out of that.
Okay.
Let's try it with the right now.
Okay. Same thing, right?
Yes.
Okay. Okay. Oh yeah, very tight.
Is one tighter than the other?
Honestly, they both felt pretty tight.
But look at your range of
Really
motion.
tight. I mean, that's
Look
really, it feels like a ball now in my calf.
Yeah. Look at your range of motion too, Jay. Not
Right
only the feeling of
here.
tightness, but how far you can lean.
I would say that the left is not as much of a ball as the right. I think the right is tighter. Yep, the right's definitely tighter, Rick.
Yeah, and from my perspective, Jay, I can barely see you moving forward on that right ankle, but I can see some forward movement on the left at least.
You're right. My ankle is not moving at all.
Right. Okay.
Like where the leg hits the foot, the ankle kind of, yeah, I would say there's very little on the right, very little.
Okay, so if the left is 100%, let's call the left side 100% loose. What would you give your right calf tightness comparatively?
Oh yeah, there's no question that there's a difference in that particular, looking at my foot, the way it's meeting the leg, there's a difference. So if my left is 100%, I'd say my right is like 60, 65.
Okay.
That's just a ballpark, you know, but
yeah, I think you're very generous.
probably maybe 50. Yeah, it's definitely noticeable difference. Yes.
Okay, we're not done.
Right. You're right. I think look, I'm not going to dispute what you just said because obviously you're the professional and I'm not.
Well, you're the one feeling it though.
But it's noticeable. No, it's noticeable.
It is noticeable. Okay, now don't move the camera back to where it was because we're not done there yet.
Okay.
Okay, great. Let's scoot up there and put the toes against the book.
Yep.
Isn't it nice to put these books to use finally?
Yeah, look at this, huh?
Okay, now I'm going to ask you to put the left balls of your foot back up on the book with the heel on the ground, just like you did before.
You do this. I think this is going to be better. Just do this. Okay. You're saying now the left foot balls.
Yes, same position. Okay, This time, Jay, and you can put your hands on the wall if you want for balance. This time, Jay, what I want you to do is I want you to bend your left knee towards the wall, towards the second toe of your left foot. And I want you to notice that you'll feel a stretch closer down towards your ankle. But I also want you to see how far your left knee can move forward when you do that.
So you're like going like this? But then
but
the heel's coming off the ground.
But I want the heel to stay on the ground.
Oh my gosh, I can't even do it.
So there's the left side.
Yep. I'm doing it a little bit, I guess, but it's not that much.
Now let's test the right.
Like stretch. You're really looking at the stretch there between where the foot hits the leg, huh?
Now let's look at the right leg.
Okay, yeah, I got that. Let's see the right leg. Okay. Oh man. It's less.
Yeah. Less, and the left wasn't even winning any prizes either, right?
No, they're both tight, but the right is, that's correct. Do you know what's funny you're saying that, because the trainer I'm working with has been really talking to me specifically about my ankle mobility.
Yeah, it's key in this situation, Jay. So we're going to compare the left versus the right. If you have a bead on that, that's great. If you want to do it again to test it.
Yeah. I would say the left, if the left's 100%, which I don't know if I'd call it 100%, but
well, let's just say for now, yeah.
Yeah, I mean, I'm moving it there. You can actually see the little fold down there. You know what I mean?
Mm-hmm.
It's like you can see my skin folded. So there's clearly some stretch. We're here. That's it, man. Oh, man.
So what number would you give me? Left 100, right?
50.
50. Okay.
That's probably generous. I mean, I don't even know.
I think so too.
Yeah. I mean, it's 40. I mean, it's like it's not even moving. The one on the left, I felt there was a little fold. The one on the right, it wasn't even moving.
Yeah. Okay, Jay. So I'm curious. So now let's just reconfirm that when you put weight on that right leg, you get pain in your right hip, correct?
Yes. Let me just double check it though.
Yeah, let's just double check it.
So right here,
Yeah.
yeah, like right here, right now, no doubt.
Okay, now, when you walk, do you get that same pain?
Not nearly as much.
Okay, and when you walk, do you feel like you're
Walking is the very best thing I can do.
when
That
you
gives me
walk?
more comfort than anything is walking.
Okay, when you walk, do you feel like you're fully weight bearing on your right leg, like you just did when you did that single leg test just now?
My fully weight bearing on my right.
So do the single leg test and just stand on the right leg and feel that pain. And look at what position your body is in right now, Jay. Notice how far your body has shifted over your right foot.
Yeah.
Now walk and see if that is happening when you're walking.
No, there's no way.
Definitely.
My is much more focused on my left leg right now.
Right. And that's why
I never thought about that before. There's no question about it. It's almost like I'm prancing on my right and my left is the dominant one. That is absolutely correct. No question. Wow, that's interesting. I guess I'm starting to see why my right leg is so weak right now.
So now what I want you to do, we're going to go back to this idea. Oh, and so let's try this, Jay. Let's try walking slower and making your right leg weight bear correctly. Let's see if that increases your pain. Now slow it down, way down, way down.
Oh, definitely. Definitely.
All right. Now, come on back here.
Oh my goodness. Definitely. So I'm being slow and deliberate right now, trying to make it as weight bearing as the left. And there's no question I can feel the pain there. Yes.
Now
all the way down my leg, actually.
Yes. Yeah. So now, Jay, what I want you to do is you're going to do the tiptoe walking again, very slowly. And I want your hands to be on your glutes. And I want you to see whether that is as painful as heel down walking, putting all that, making that right leg work the way it should. So go very slowly.
It is not as noticeable, Rick. It's not as painful.
What percent difference would you say? If walking on the heels is 100% painful, what would you say tiptoe walking is?
Oh my goodness. This hurts, like when I do this slow.
Yes.
And this, you know where I feel it is my foot, like because it's almost like the foot's like, I'm on my tiptoes, so I'm feeling it on my foot. But in terms of the glue, I don't know, not even 20% maybe.
Great. All right.
Yeah.
All right. So Jay, I'm gonna now.
There's a very noticeable difference in the pain in my leg when I was on my toes. That's correct.
All right. So I'm going to take some time now and explain to you what I think is going on here.
Was that an informative test with that whole tippy toe and the?
Oh yeah, yeah.
All of it is. All right.
Hopefully it was informative to you. So
I'm seeing it.
So I'm going to explain all of these tests and how they fit into your pain. Okay. So you can get comfortable in any way you want.
This is probably the most comfortable, right?
Okay. All right. So let me just look over my notes real quick and confirm. All right. Oh, one more question for you, Jay. Do you ever lie in your stomach to reduce your sciatic pain?
No, never tried it.
Okay.
I've never tried it. I've always been told it's the worst thing for your back, but who knows? I don't know if that's true. I'm just telling you, like that's kind of like it's like a wives' tale as far as I'm concerned. I have no idea. It's just one of those things that's stuck in my mind.
Yeah. Okay. Well, we'll think about that. All right. So one of the things that's going on is you have what I believe that you have a anterior femoral glide syndrome. And what that means is that the femur head is sliding forward excessively in the hip socket. especially happens when the hip is flexed. All right. Why would this happen? It happens because of poor gluteal performance. The gluteals attach from the sacrum to the hip bone here. And when they're not working correctly, this hip then glides forward. And what that does, if you can imagine a washing machine that's out of balance, that it's careening around in the hip socket. And what this does is it causes hip bursitis. It'll cause piriformis syndrome in the back. It'll cause general arthritic changes in the hip. And because it's migrating forward, it can cause labral tears in the hip and femoral acetabular impingement syndrome and groin pain in the front. Okay. Now, when the gluteals aren't working correctly, fortunately, we have other muscles in our body that can reproduce what the major muscles are doing.
Yes.
So one of those muscles is the piriformis muscle, which you've probably heard about a lot and researched.
Yep.
And that, of course, goes from the sacrum to the hip bone also. So when the butt muscle does not work correctly,
Yep.
it falls to the piriformis muscle to do the work of the butt muscle. Well, it's a little pinky muscle, and the butt muscle is a big hand muscle. So this is why a lot of sciatica occurs, is because of overworking of the piriformis muscle.
Interesting.
Because of poor gluteal function. Okay. So the answer is not, I mean, you can stretch the piriformis if you want, but it's not going to help the glute muscle turn back on. All right.
Right now, my glute muscle is not performing as it should. That's what you're saying.
Correct. Correct. And I believe when you tighten up your butt muscles, what you're feeling a lot is your deeper piriformis muscle contracting a little bit more so than your gluteal muscles contracting. That tightness that you're feeling when you say, "Oh yeah, it's engaging when I'm walking," I think it's your piriformis that's engaging, not your big butt muscle that's engaging. Okay, but we'll fix this.
My walking is being sort of supported by the pinky muscle, not the glute muscle.
Correct.
Interesting.
Now, when I have you tiptoe walk, that helps you turn on the big muscle, the butt muscle.
Yeah.
And lo and behold, your pain goes down by 80% when you're walking correctly.
It does.
Right? So what we have to
part of the reason I'm getting comfort in my walking is because it's the dominant left leg that's really carrying.
Exactly. You're not really weight bearing.
Getting so much stronger than my right leg right now.
Yes. And if once you look back at this video, you'll see your whole right trunk has shifted away from your right leg. So your right pelvis is higher. Your whole trunk has shifted away because you're not weight bearing any longer on this right leg. What you've developed is something called a side bending problem. If your physical therapist measures your pelvic height, they'll see that the right pelvis is much higher than the left. And the right rib cage is lower than the left. So you've got compression on this side of your spine as a result of the way that you're walking. This compression alone can also create sciatic pain. So you may have two issues feeding the sciatic pain. Both are correctable, but I can't say it's one or the other at this point.
Okay.
All right. So, and the problem is that when you try to weight bear on that right side, as you just found out, you have a lot of pain in your right hip.
No doubt.
But you don't have that pain if you're on your tippy toes. Why? Because the tippy toes are helping turn on your butt muscles.
Interesting.
Okay. And what that's doing is then controlling the hip bone in the socket, which then calms down the piriformis muscle. Make sense?
It does make sense. It makes total sense.
Okay.
And both of the reasons that you just cited could be part of the root cause of this sciatica pain right there.
Well, the true root cause is your right ankle. So the whole reason this right hip has broken down in the first place is because your right ankle, you don't have the range of motion. We didn't even test strength, and I bet you don't even have the strength in that calf and soleus complex either. Because without range of motion, it's hard to have strength. So I think that you have been unloading this right ankle for decades, which has created, or I'm sorry, this is the right ankle. So when you unload this, it's like what you're doing on your left leg already. Your right leg doesn't get to work. the pelvis rides up, the rib cage drops down. And so the right ankle, I believe, is what created this whole side bending pattern in the first place, and also caused the gluteal muscles to turn off. And what's happened is it's just catching up to you now in the form of hip degeneration and now sciatic pain. Okay?
Makes sense.
All right. So ultimately,
Well,
we can get
depressing,
this.
but it is what it is.
Well, fortunately,
Diagnosis is good, though. Diagnosis is good. That's good.
It is. This can change. All right. Now that you know what the problem is.
Yes.
Now, in addition to this, you have what's called two retroverted femurs. All right. This is very common in men. It means that the thigh bone is rotated outward. Okay. So when you're walking, your foot should be pointed outward because your thigh bone is rotated outward. And you do that with your left side. And that's a good thing. And I'm going to ask you to rotate it out even more, because the butt muscle is an external rotator. And if we turn the foot out and externally rotate it, it's going to bias the butt muscle to turn on even better.
Interesting.
Does that make sense?
Yes. So you're going to ask me to walk with my left foot facing outwards.
I want your left and right feet. I want your right foot to face outward even more.
So like literally like walking like this.
Yes. Now walk like that. Hold on, Jay. I want you to slow down that walk and make your right leg weight bear like it's supposed to, but with the right foot externally rotated 3 or 5 degrees even more than usual. Okay. Let's test and see whether this takes away some of your pain too.
So when I go, so I should go for a walk today and go for my walk tomorrow morning.
Do it right now in the room like you did with the tiptoe walking.
So yes, it's less pain in my glute. Now what I'm finding though is that the pain in my right leg though, all the way down to my foot, is still there. Do you know that?
Correct.
Yeah. But the glute, it's less pain in my glute. That is correct.
Good. All right. Now you understand why, right?
Wow. I mean, yeah, it's not, oh my goodness, it's noticeable. I mean, it's not 100%, Brett. It's not 100%, but it's noticeable.
I understand, but that whole right hip area is so inflamed right now. So once we start doing more of these types of things, it's going to decrease that inflammation. So it should feel 100% maybe tomorrow or the next day. Okay.
Wow.
All right. So the sciatic pain in your foot and ankle, the lower leg, could also be due to the lack of mobility of your right ankle as well. It may not all be coming from the hip. All right. So we'll figure that out sooner, or a little bit later. I mean, once we correct a lot of this hip issue and your walking pattern, we'll see if that also corrects the foot. But even if it does, Jay, we need to correct this right foot and ankle complex, because it's ultimately going to lead to the breakdown of your hip replacement.
Okay.
All right. All right. So you have two retroverted femurs. We're going to turn your feet out a little bit more, all right, than usual, 3 to 5 degrees, nothing huge, to help turn on the gluteal muscle, all right, which will then calm down the piriformis muscle that's causing a lot of, possibly the primary source of your sciatic pain. We don't know yet. But also what will happen, because you can weight bear better without pain, that means you're going to shift your weight more onto that right leg and get rid of the side bending problem that you have. All right. So what I'm going to ask you to do now is walk on your tippy toes or with the foot turned out a little bit more, but I want your right hand to be up in the air reaching.
So what would you prefer, the tippy toes or?
It's up to you, whatever you feel better and more natural with. So every time you step on that right leg, Jay, I want you to lengthen the right hand up in the air a little bit more. So take a moment and hesitate to stretch that right side.
Rick, it's definitely feeling better.
Good. So what are we doing when we lift up that arm?
So basically, I'm
Well,
keeping this arm up, and then I'm like very pronounced on my right foot with almost like I'm almost like way over.
yes.
Is it too far over when I do that?
No. Your brain is going to say that it's way over because your brain has gotten used to being over on the left side all the time.
So I need to make sure that I'm focusing my weight on, I have to be deliberate and intentional of making my right weight bearing right now. Yeah. And when doing so, keep that arm up and keeping that foot out and just walking normally.
Or tiptoe walking, yes. Whatever you feel is better.
Probably this one is better.
But I want you to reach even higher though, Jay. You really to reach, every time you stand on that right leg, reach higher with that. There you go. That's what I want to see.
Wow.
Let me show you what that's doing.
You know, what's bothering me now more is just the right leg below the knee.
Yes.
Interesting. Okay. Keep going. All right. I'm doing it. Yep.
All right. So by raising that right arm, can you see me?
Yeah, I'm taking a sorry about that.
By raising that right arm up in the air, you are lifting the rib cage off of the pelvis. And by hesitating,
I want to raise that arm as much as I can right now.
Exactly, because that's reversing the side bending problem that you've created over all these years. Okay.
Okay.
So you want to raise that up. That's going to lift the entire rib cage off. But more importantly, what that's going to do is, especially if you just slow down for a half second on that right leg, it's going to force the right leg and hip muscles to work the way they're designed to work, which is to support this whole right side. Right now, you don't have that strength or support. You just give into it and collapse with every step. All right. But we're not going to let that happen anymore. Okay. So this, if your sciatica is coming from your spinal column, this behavior should decrease a lot of that spinal column related sciatic pain.
Okay. Well, hold on. I'm trying to see. So basically, wow, this is crazy. All right. I'm trying to process, Rick, what you're telling me right now.
You can replay this. We're running out of time, so I just wanted to get through the rest of this for you.
So now what I'm hearing you say is the most important rehabilitation I have to do right now is walk in this way with that arm up.
Correct.
So keep the arm up.
We give an explanation, I guess.
Give me 1 second. Sorry about that. I had to do
Fran Ragsdale
one thing.
started the movement. It sounds like her machine crashed. But she got it back to 1 o'clock.
Okay, good. Sorry about that, Rick.
So I'm not done yet. All right. I'm also going to give you one exercise to strengthen your right gluteals. This will target your right gluteal muscles and get them back. It'll get your brain connected to your butt muscles again. Because right now your brain, I don't believe, is well connected to that function. All right. So I'm going to send you the reaching while walking exercise. I'm going to send you this glute strengthening exercise. I want you to do it twice a day.
Okay.
Yeah, let me.
Yeah, you know what I have to do? I have to get out of here. Hold on.
Okay, I'm going to go down the hall.
Sorry, I had to do this. Okay. So.
Stuck.
Okay, done. Go ahead.
All right. And so you're going to work up to 30 repetitions per leg with the glute pumps I'm going to give you. And then you're eventually going to be putting a weight behind your knee up to 20 pounds to get that guy really strong. One of the reasons that your glutes have to be stronger than usual, Jay, is that your right ankle, I think, is going to be a perpetual problem because you have screws in that ankle and you have accommodations in that ankle. You may not be able to get it back to 100%, but that's what you should be focusing on with your rehab, is getting that ankle going, getting your glute conditioned, right? But rehab, typically with glute strengthening, they want to do lunges and squats and things like that. That's a multi-joint exercise that's too much for your brain to isolate. That's why this butt pump exercise will be the best one.
So for now, that's where I should be focusing my attention right now.
I'm not done yet.
Okay.
There's one more exercise. So if you remember when we did the side plank, you were unable to do a side plank on both sides.
That's correct.
You are lacking lateral stability in your trunk. And if you look, when you rewatch this video and you with your shirt off and you see that your whole right trunk is shifted over to the left side, it's no wonder. All right. So I'm going to send you, but when do we need lateral stability? We need lateral stability when we're standing and walking. All right. And you don't have that right now. So I'm going to send you one more exercise to strengthen the lateral stability of your hips. And you'll be focusing on standing up tall without any weight shift when you're doing this. And by standing up tall without weight shifting, that will strengthen your body's ability to withstand the weight shift that you've been doing for the last couple decades at least. Okay.
So right now it's like my brain is just not communicating properly with my muscles. That's the issue because of all the compensation that's occurred, primarily because of my ankle injury more than anything
Correct.
else.
Correct.
You know, I almost didn't even put that in the intake. I was like, I don't know if that matters.
Yeah.
But oh my gosh, does it matter?
It does. It all comes back to that ankle. That was the key.
My gosh.
All right.
All right. So you're gonna send me that other exercise
Yeah.
too.
So you've got three things to do really. One is reaching while walking, putting the feet out, or on tiptoe walking. And I would say, Jay, every time you get up from a chair, your first 5 to 10 steps should be reaching while walking with your feet turned out or tiptoe walking to reactivate that whole lower body system correctly.
So when I get out of bed, I need to do that immediately.
When you get out of bed, when you get off the toilet, when you get out of a chair, anytime.
Arm way up as high as I can.
As high as you can.
Pronounce feet going outwards and put all my weight on my right like I do on my left.
Yes. You're lifting the rib cage off of your pelvis and you're realigning your spine so it's straight again. Okay. The second exercise is going to be the butt pump because we need to get that stronger and get your brain connected to what's going on there. The third exercise is going to be the standing exercise to strengthen your lateral stability so you don't shift over to the left all the time. So you can finally have the strength to hold yourself up straight rather than shifted to the left. And then what I would like you to do if you're still seeing your physical therapist is have them evaluate your ankle and start working on that range of motion. I have other things for that, but I don't want to go down that road until we get this, 75% fixed, this pain reduced. And then I've got some ideas about your ankle. Okay.
So for now, then I was going to see another physical therapist, but maybe I just stick with you for now. I think that's
I think, and they may have valuable things, but I think
at this moment, I need to stick with you and get myself to a point. Because right now, like I was going to see a guy that was going to help me get back on the golf course, but this is too early for that. I mean, I got
way too early.
Okay.
All right. So once you get to about 75 to 90% better, I would say then we can, take it to golf.
Explore that. Yeah, but I got a long way to go on that though.
Yeah.
Okay, so when should I see you next?
Well, my hope is that you don't need to see me next.
Oh, good.
What we'll do is try and communicate through email.
Okay.
As much as we can. If we need another appointment, then we'll have one. But so far, I haven't had anyone who needed a second appointment.
It sounds like you have a pretty good picture of what's going on with me, which is
more importantly, hopefully you do.
I think I do. I'm going to rewatch this video, of course. So you'll send this to me then?
Oh yeah.
Okay. Rick, thank you.
My pleasure.
Thank you.
Yeah.
Oh, boy, am I glad I made this decision. It's a good decision. I feel like this is going to be a breakthrough. Honestly, I can't even believe just walking was feeling better.
Yeah.
All right. Got to keep that arm up. And then you're going to show me the butt pump, right? You're going to show that to me. And then the standing exercise, I'll look at those online.
Yeah. I'll send you those videos as well as the reaching while walking one.
Okay.
And you'll get this and then you'll have my email. And then what we'll do is communicate from there on. In 3 to 5 days, I'm going to ask you to let me know how things are going. I expect your pain to be significantly reduced in 3 to 5 days if you're doing these things. And
So how often am I doing these again? So the walking, so if I walk 45 minutes, just keep doing that. As much as I can walk, do it, but just do it that way. And then these other exercises, you're going to let me know how many times a day to do them.
twice a day. You'll see, and then you'll see on the videos, the reps and all that kind of stuff. Okay.
Okay. But then walking as much as I can is good, right?
If you walk correctly.
Okay. It's got to walk correctly. Yeah, I will.
Yeah.
And then get that foot protruded out, arm up, and just walk, making sure I have equal weight distribution.
Yeah.
Gosh, Rick,
So
all right.
I think it would be helpful, Jay, if you belong to a gym, to go do that in front of a mirror and really observe yourself. And what I often recommend people do is that they put their iPhone out there and videotape themselves walking to and from the iPhone, because that lets you see yourself objectively. When it's happening in real time, people can't see themselves objectively. Okay.
So should I avoid my other training right now for now? Just kind of focus on this until my pain is reduced?
You know what you can do is apply these principles to your other training.
Okay.
And see where your other training is feeding or hurting you, and correct those issues.
Okay.
Now that you understand what's going on.
Thank you, Rick. This is good stuff.
Yeah.
It's a pleasure to meet you, and we'll stay in touch.
Yeah.
Thanks.
So I'll get you this email probably in a couple hours. It takes Google Meet a while to download these things. So, but I'll get that email to you today in a couple hours. Okay.
Rick, real pleasure. Thanks so much.
All right,
Thanks.
Jay.
I feel like I'm much more enriched right now, so I really appreciate it. Thank you.
Great. My pleasure.
You're helping another human being right now, Rick. I'll tell you, and I thank you for that. So,
My pleasure.
Thanks.
My pleasure.
See you later, man.
All right,
Thanks.
all right, Jay.
Thanks a lot,
Bye-bye.
Rick. Nice meeting you.
All right. You too.
Bye.